What are the similarities and differences between the COVID-19 pandemic and the AIDS pandemic?
There are several similarities between our COVID pandemic and the HIV epidemic. Both evolved rapidly, both are global events, and both tend to affect specific populations more than other parts of the population. For COVID, the greatest number of deaths so far has been in the elderly. For HIV/AIDS, the initial infections were identified in groups of people who were socially isolated, gay men, and IV drug users. Many governments did not respond either to the COVID pandemic or HIV/AIDS epidemic. In the case of HIV/AIDS, it took the hard work of activists to find new treatments, to provide support for people affected by the disease, and to elevate the profile of HIV/AIDS. Compare that to the financial aid packages offered by the Canadian government during our COVID pandemic. Compare that also to the number of pharmaceutical companies that are in a race to find a COVID vaccine and new antiviral drugs to fight the disease. It is also interesting to note the identification of COVID-positive celebrities by the media. For instance, Tom Hanks and his wife, Donald Trump, Boris Johnson, Prime Minister Justin Trudeau's wife. When they all tested positive, they're identified in the media as if it was a characterization of bravery for having been infected with COVID. This is not the case with HIV.
How can Albertans combat inequalities in healthcare?
We need to speak out. We need to educate ourselves on the issues, no matter what the health issue is. We can show our concern by writing letters to your newspaper editors, to your MLA, to your MPs. We can join protest. We need to ensure that health policies are health-driven, not politically or socially motivated. We need to not judge the afflicted. We need to not racialize the population that is suffering from the disease. We need to work on the principle that all people should have the same health rights.
How widespread is HIV/AIDS within North America? Who is the most affected by it?
As of 2016, in North America, there was approximately 1.5 million adults and children living with HIV/AIDS. 70,000 adults and children a year are infected with HIV/AIDS, and 26,000 people in North America die from AIDS every year. In Canada, the number of people who have HIV is actually increasing. The incidence, or the rate of new cases right now, is 6 out of every 100,000 people. Indigenous people and people from countries where HIV is endemic are overrepresented in the HIV epidemic in Canada. And of the people that come from countries where HIV is endemic, some of them are refugees. A criteria for entry into Canada is that they will be tested for HIV. Many of them are hesitant because they fear that this will preclude them from entering. That is not the case. The Canadian government tests refugees in order to be able to provide treatment for their disease. Approximately 14% of people with HIV in Canada are unaware that they have HIV. In Alberta, based on 2011 statistics, the HIV epidemic is concentrated mainly in people who have heterosexual sex, and that makes up 43% of the cases in Alberta.
Is there a health issue that is most pressing within Canada?
There are many health problems in Canada that are just as pressing as HIV/AIDS. To name a few, substance abuse, poor living conditions in some of our First Nations settlements, multi-drug resistant TB in our marginalized populations, a homeless population that struggles with mental health issues that prevents them from obtaining appropriate medication or appropriate housing. So it is difficult, therefore, to identify any one disease or health condition that is the most important. Rather, it is more important to be aware of how much can be accomplished by activism, and the film, From Durban to Tomorrow, is evidence of this.
I hope you enjoyed today's screening. I would like to take this time to thank you again for supporting the Marda Justice Film Festival during this very special year. Our festival could not have survived without your continuous support. Please subscribe to our mailing list through our official website or follow us on social media. including Twitter, Facebook, and Instagram, to receive the latest updates. As we move forward toward 2021, a lot remains uncertain. However, we will do our best to keep you informed about our festival. Thank you again for joining us tonight. I wish you and your loved ones all the best in the month to come, and a good night.